Hypertension, often called high blood pressure, is one of the most common chronic conditions affecting adults worldwide. It's a condition where the force of your blood against your artery walls is consistently too high. Understanding hypertension is crucial, not just for general health knowledge but also for aspiring nurses, because nurses encounter hypertension in virtually every clinical setting and it's a major focus on the NCLEX. You'll find questions about its causes, complications, and of course its management. It affects patients across all specialties, from pediatrics to geriatrics, making it essential for safe nursing practice and quality patient outcomes. A solid understanding of hypertension is a cornerstone of competent nursing care. Uncontrolled high blood pressure leads to serious health problems like heart attack, stroke, kidney failure, and vision loss. These complications highlight the importance of early detection and effective management. Nurses play a key role in identifying, managing, and educating patients about hypertension, empowering them to take control of their health. The NCLEX tests your ability to assess, implement orders, administer medications, and teach patients about this condition, ensuring they understand their treatment plan and lifestyle modifications. Mastering hypertension is about more than passing the exam, it's about patient safety and making a real difference in people's lives. This guide breaks down hypertension from definitions to nursing care, with clear explanations and NCLEX tips providing you with a comprehensive understanding. Think like a nurse. What would you do if a patient's blood pressure was dangerously high? How would you prioritize your actions? The NCLEX uses clinical scenarios, so you must apply your knowledge, not just memorize facts. Critical thinking is key to success. This guide will help you connect the facts to real-world nursing actions, bridging the gap between theory and practice. For more resources and practice questions, check out educational platforms like Brispa International. Hypertension, often called high blood pressure, is a common condition. It's defined by blood pressure readings, which are measured in millimeters of mercury or mmHg. These readings are expressed as systolic over diastolic. Systolic pressure is the pressure when your heart beats, while diastolic is the pressure when your heart rests between beats. Normal blood pressure is considered to be less than 120/80 mmHg. This is the ideal range for maintaining good cardiovascular health. Elevated blood pressure is when the systolic reading is between 120 to 129 and the diastolic is less than 80. With elevated blood pressure, the primary focus is on lifestyle changes here. This includes diet, exercise, and stress management. Hypertension stage 1 is defined as systolic between 130-139 or diastolic between 80 to 89. Stage 1 hypertension may require medication, especially if the patient has other cardiovascular risk factors such as diabetes or high cholesterol. Hypertension stage 2 is when systolic is 140 or higher or diastolic is 90 or higher. Stage 2 hypertension usually needs both lifestyle changes and medication to effectively manage blood pressure and reduce the risk of complications. A hypertensive crisis is a dangerous condition where blood pressure is over 180/120. This requires immediate medical attention to prevent organ damage. Nurses play a vital role in educating patients on lifestyle changes at every stage of hypertension. They also administer and monitor medications as ordered by the physician. It's crucial to know these numbers for the NCLEX 120/80, 130/80, 140/90. NCLEX questions may ask you to classify a patient's blood pressure based on these ranges. Remember, patient education and early intervention are key nursing responsibilities in managing hypertension. So memorize these categories. They're NCLEX favorites and essential for providing quality patient care. Blood pressure is determined by cardiac output and systemic vascular resistance. If the heart pumps harder or vessels are tighter, blood pressure rises. Most hypertension is due to increased resistance from narrowed arterioles. Kidneys regulate blood volume. Retaining salt and water increases pressure. The renin-angiotensin-aldosterone system, RAAS, is a key hormonal regulator. Many antihypertensive drugs target this system. Hypertension results from the heart pumping too hard, vessels being too tight, or too much blood volume. NCLEX tip: understand how changes in cardiac output, resistance, and volume affect blood pressure. Questions will test your grasp of these relationships. Hypertension is either primary, essential, or secondary. Primary hypertension is most common. No single cause, but genetics and lifestyle play big roles. Non-modifiable risk factors: family history, age, ethnicity, especially African American. Modifiable risk factors: obesity, inactivity, high sodium diet, alcohol, smoking, and stress. Nurses focus on teaching patients to change modifiable risks. Secondary hypertension is due to identifiable causes: kidney disease, thyroid issues, adrenal tumors, sleep apnea. Treating the underlying cause can resolve secondary hypertension. NCLEX tip: differentiate primary from secondary hypertension. Know which risk factors are modifiable for patient education. Expect questions linking risk factors to patient scenarios. Hypertension diagnosis requires multiple high readings on separate visits. Blood pressure varies, stress and activity and white coat effect can cause temporary spikes. Standard measure BP in office, seated, feet flat, arm at heart level. Ambulatory or home monitoring may confirm diagnosis and rule out white coat hypertension. Nurses teach patients proper home BP monitoring technique. After diagnosis, tests check for organ damage and secondary causes: urinalysis, blood tests, ECG. NCLEX tip: know the correct procedure for accurate BP measurement. Expect questions on diagnostic steps and patient teaching. Hypertension is the silent killer. Most patients have no symptoms. Regular screening is vital. Damage can occur even if patients feel fine. If symptoms appear, they are usually non-specific. Headaches, dizziness, nosebleeds, often only at dangerously high levels. Nurses must watch for signs of target organ damage: chest pain, shortness of breath, vision changes, weakness or speech trouble. Hypertensive crisis: severe headache, confusion, shortness of breath or seizures, requires immediate action. Most common symptom: no symptom at all. Patient education should stress the importance of regular monitoring. NCLEX tip: recognize signs of organ damage and hypertensive emergencies. Questions will test your ability to identify subtle and severe presentations. Always assess for complications even in asymptomatic patients. Hypertension management often begins with lifestyle adjustments. These changes are the first line of defense and serve as the essential foundation for all patients, regardless of the severity of their condition. Teach the DASH diet, which stands for dietary approaches to stop hypertension. Emphasize sodium reduction in their diet. Encourage regular exercise, aiming for at least 30 minutes most days of the week. Promote weight loss if the patient is overweight or obese. Guide patients in limiting alcohol consumption. Support and encourage quitting smoking, and provide strategies for effective stress management. Nurses are primary educators, playing a vital role in guiding patients through these lifestyle changes. If lifestyle changes aren't enough to control blood pressure, medications are added to the treatment plan. These may include thiazide diuretics, ACE inhibitors, ARBs, and calcium channel blockers. Many patients need more than one medication to achieve optimal blood pressure control. Nurses administer meds, carefully monitor their effects, and teach patients about potential side effects and the importance of adherence to the medication regimen. Never stop meds suddenly, as this can cause dangerous spikes in blood pressure. No drug classes: ACE inhibitors, which typically end in pril, beta blockers, often ending in olol, and their key side effects. NCLEX tip: be familiar with mechanisms of action, potential side effects, and patient teaching points for antihypertensive medications. Patient education and careful monitoring are critical nursing roles in hypertension management. Use resources like Brispa International for a deeper dive into pharmacology review and understanding. Uncontrolled hypertension causes serious, often irreversible damage. Heart leads to left ventricular hypertrophy, heart failure, angina, and heart attack. Arteries atherosclerosis, narrowing and stiffening raises risk of heart attack and stroke. Brain risk of hemorrhagic and ischemic stroke, vascular dementia, kidneys, chronic kidney disease, end-stage renal failure, eyes retinopathy, vision loss. Nurses must monitor for these complications and educate patients on risks. NCLEX tip: link hypertension to heart, brain, kidney, and eye complications. Questions often connect these conditions. Know the relationships. Early intervention prevents life-altering outcomes.